Lynn here with a non-traditional pharmacist, part of the Pharmacy Podcast Network. And we are here today to talk about an area of pharmacy that's definitely becoming more mainstream, and that's integrative medicine. We have two guests with us today. First, we have Dr. Pam Tarlow, who is a clinical integrative pharmacist. Pam is currently practicing at Santa Monica Homeopathic Pharmacy, where she works with providers and patients on the safe use of pharmaceuticals, botanicals, homeopathic nutritional agents, therapeutic essential oils, and lifestyle strategies. Additionally, she's an educator and lecturer at several pharmacy programs, including the University of Southern California, where she actually went to pharmacy school. And this is very cool, serves on the United States Pharmacopoeia Dietary Supplement Quality Collaboration. And she is also director of the PGY1 Integrative Health Pharmacy Residency. Also joined with us is Dr. Swathi, who graduated from the Medical University of South Carolina with her PharmD and is currently a PGY1 Integrative Health Pharmacy resident. Both Pam and Swathi have co-founded Pharm Supplement, which is a natural medicine educational platform for healthcare professionals and students where they provide pharmacist-designed resources, online courses, and drug information services. So thanks so much to the both of you for taking the time and being on the show with us today to share your story.
Oh, thank you so much
Thanks for
having
asking us.
So let's jump right in and start with an overview of integrative medicine, because I think a lot of us aren't that familiar with the term. Like, does it include homeopathic medicine? Is it supplements? If you could just give us an overview of what integrative medicine is.
Would you like to start, Swathi?
Sure, yeah. So the way that I see integrative health or integrative medicine is a multimodality approach. So it's conventional pharmacotherapy, so prescription medications that you'd normally think of, but plus other modalities of health. And so that could be through natural products, dietary supplements, meditation, homeopathy, like all those different possibilities to help the patient. And the way that we have talked about it also is that it really centers around a patient-centered shared decision-making model. And so that's working one-on-one with the patient to make a decision that's best for them.
Okay, so it almost sounds like it's a branch of functional medicine. Would you say that's correct?
The terms tend to overlap, and functional medicine has some other characteristics. Integrative may be more of a broad umbrella term.
Okay, so that includes the homeopathic, and like you said, there's a bunch of areas that's included in integrative medicine. So
Yeah.
tell me a little bit about your specific role, your current role that you're in now.
Both of us are in some shared roles and some different roles, but I think the way Swathi explained it before is really that we have embraced and learned and utilized other strategies other than just pharmacotherapeutics. And so some of our work is one-on-one with patients at a pharmacy. Sometimes it's direct consultation with people outside of the pharmacy. There's educational, different components, clinic work. We're both involved in some clinic, lots of education. So it really varies, but it kind of boils down to the question, what can I use with my medications, or what would be harmful if I took it with my medications? Do I choose this or that, or can I take them both? And then also, when a situation comes up that a particular patient either can't or won't take a certain kind of medication, we see both. Sometimes they can't because of risk factors or other factors, availability factors, or sometimes they just don't want to, and their doctor has told them as long as they get symptom relief or their biomarkers improve, then they can try things outside the box a little. And so we're there for that, not saying that this is the one way to do it, but hearing the patient's story, or in some cases the clinicians talking about the patients to us, and then providing certain options, showing advantages, disadvantages, etc.
Okay, so I'm trying to get an idea of what it's like to be an integrative pharmacist. So are you in, so you're not necessarily in a standalone pharmacy, is that correct?
I am, yes. And the residency it's at a very unique pharmacy.
Okay.
One that does prescriptions and has a lot of natural products, and we've developed a way of talking to people about those, and we have them available, also checking for drug interactions.
Oh, okay. So then you also do dispensing of conventional therapies, so medications, in addition to supplements.
We are a licensed pharmacy. Yes.
Excellent. Okay, that is very, very cool. And
So
then
we feel like that's the place it can be most effective.
absolutely, absolutely, because that's where you're able to get the full history of the patient. You can see what medications they're on and how it interacts with, I think a lot of people, I know when I was in pharmacy school, I learned a lot that on the job training that necessarily wasn't taught in my curriculum, that, people would come up and they would be on several or at least one supplement, which a lot of people don't think of, and how important it is to know the interactions with that. So that's very cool that you're able to incorporate that into it, like community pharmacy almost.
A community pharmacy, that's one setting. There's other, everywhere we go now, we are integrative pharmacists because we've integrated it within ourselves also.
So that includes the consulting that you were saying?
Mm-hmm. Yeah, and yet if somebody is consulting with us and they want strictly medications, we can talk about that too.
How did you find that this was a need in pharmacy? So I know you guys started this residency program that you both co-founded when you were going through pharmacy school. So I know, Pam, you've been a pharmacist, and then you weren't in this right away. Is that correct? You kind of
No, it took me about 15 years before the need came up. I saw the unmet need in my patients. I was working for an independent pharmacist and got a lot of questions that I couldn't answer, and became interested in being able to round out my education so that I could provide complete consultations with patients. So I've only been doing this about 25 years out of the 40 years of my pharmacist career.
Yeah. Wow, that's so great that you're able to find a void in pharmacy and do something about it.
And that's only increased. The need for healthcare professionals to be a place for patients to ask questions has only increased, including today. I think it's with what's going on in the world today and what people are asking and the availability of products. Back 25 years ago, there wasn't social media and internet sales that we have now. And so people are using those as resources rather than us as pharmacists.
And that can be misleading because, if you rely on the internet, then you don't know who's saying what on there. We need the resources and the studies that show what's safe and what's not. And that's where I think pharmacists can come into play and really incorporate that into everyday, everyday practices across the board of pharmacy, whether it's community, whether it's clinical, whether it's consulting.
Even in the emergency room. Now, you need to hear Swathi's story about how she, since she's a recent grad, how she got involved with this. Please tell us.
Yeah, I'm curious to get Swathi's perspective as a recent grad. What do you have for us?
So I'd always been interested in nutrition and holistic health and wellness, but I didn't know anyone, whether they were associated with my pharmacy school or someone like a family friend I knew who was a pharmacist. I didn't know anyone in like the healthcare field that was doing anything like integrative health related. But this all changed when I found that Dr. Tarlow was doing an API rotation at her site. And so I had an opportunity to come out and do a 4-week API rotation with her. And at the end, I really found that this was my place in pharmacy. And I was so overjoyed and excited. So I talked to Dr. Tarlow about potentially starting a residency or having me train for a year and what that would look like. And then it kind of just blossomed from there. And we started in July, and I can't believe it's already April.
Yes.
Yeah. So you found it on when you were on rotation, and that's how you became interested. So actually, this is a good question for you then, Swathi. In terms of, advice that you'd give to somebody looking to pursue a similar role, that's going to be different for a student versus a pharmacist that's looking to transition into it. So what advice would you recommend or give to a pharmacy student right now that's interested, whether they're early in their career or they're looking to pick rotations? What advice would you give if they're looking to pursue a similar role?
Yeah, definitely. So I would say there's so many great resources whether we're talking about podcasts, whether we're talking about various free newsletters that you can get from different websites that we can link for you if you'd like, or you can put them in your caption maybe.
Yeah, that would be that'd be
There's
great.
so many great opportunities to learn. So I think just even starting there with just like trying to feed your interest in that way. But then the other thing that I think is so important is networking. And so I would say like anyone, no matter if they're like a first year pharmacy student or a pharmacist that's been working for however many years, everyone should have like a LinkedIn or some sort of method to network with other people, because I think when you speak to other people about what they're doing and anything that they're interested in, you can feel that passion and actually really get a better understanding of what that field is. So I think that if people connected with us, for example, we could talk about our experience more, but there are plenty of other people doing amazing things and you just need to
Mm-hmm.
find them through networking. Yeah.
Oh, absolutely. Networking is definitely one of the most important ways to get an idea of what's involved in the job. And I love that. Definitely networking. So I'll be sure to include those links underneath the post. And for pharmacists looking to transition, so say you're in the field, for example, a community pharmacist looking to transition into integrative medicine, what advice would you give to a currently practicing pharmacist?
I'd like to speak to that for a minute. This is Pam.
Mm-hmm.
Yep.
My view of it, and I've been thinking about this for many years. This is not a new subject for me. Is that it's more of an expansion rather than a transition, because I don't leave anything behind that I learned in pharmacy school or in a conventional practice. I just add on to it and look to see if what my patients are taking. So I'm listening to my patients, always listening to my patients. And when they ask about supplement A or homeopathic medicine B or whatever they talk about, nutritional strategy C, I'm always thinking about that in the way I think about anything. Who would be harmed by it? Who might be helped by it? What's the benefit to the risk? Is there solid evidence? This is straight pharmacy, so there's no transition out of that. It's just opening up to really the way the body is able to maintain its own resilience and its own homeostasis. And that's what nutritional products and homeopathic medicines can offer that pharmaceutical medicines can't really, as wonderful as they are for certain conditions once they've gotten to a certain point. Is that that's what the message I would really like to say. And it also depends on why a pharmacist, a traditional pharmacist, might want to make this expansion. There could be business reasons. They could want to expand into the cannabis medicine market so that patients can come to them for certain products depending on what state they're in. And that's really blossomed in this year that Swathi and I have been working together.
Yeah, I love that. I love that you said it's an expansion, and thanks for clarifying that, because it's true. You go to pharmacy school, you have all this education and great knowledge on conventional medicine. So to adding on to that with the further knowledge of supplements and integrative medicine, I really like how you phrase that.
I think that's the key. The key is for us to always be pharmacists and then add on either due to our patients' needs. So anyone who's listening to this, patients may have certain need, certain populations. And if you're an oncology pharmacist, you might be interested in products that don't interact with oncology drugs that may ease patients' symptoms, side effects, so that they may complete their course of therapy. Something like that. If you're an infectious disease pharmacist, there may be ways of repairing the gut once antibiotics have been given. Those, I think, I started with what I was interested in. And I believe that's what Swathi has done too, from my observation as a residency director. But she's gone with what she's interested in and what the needs of the people that she's serving. And that is a fabulous way to start, because you can start helping people pretty soon after doing that.
Yeah, I mean that's great. You guys are leaders in the pharmacy, in the sense of again finding that problem and incorporating it into what you're interested in. So that's definitely great that you guys are doing that. Now, one of the major goals of the non-traditional pharmacist is to give pharmacy students and pharmacists a true look into what's involved in the job. So in terms of geographic location, from my understanding, you guys are in California, is that correct?
Hmm.
So that seems to be on the front end more of the natural medicine and and like what you're doing right now. I practice in the Midwest and it's not as common here. Would you say that you're restricted by geographic location, or do you think it's something that people that are interested in should be kind of a pioneer or a leader and try to somehow incorporate it into their current practice of pharmacy?
I don't think there's much restriction. That is true. Where we practice it, there's a lot more conversation and acceptance. That is true. And there's also a lot of physicians and other practitioners that practice integrative medicine around us. But in the day of social media and internet, I think that everybody's hearing about it. All patients are hearing about it. What really concerns me is, among other things, is that our patients that we're filling prescriptions for are taking these products, but they're not telling us because they don't think we care, or we don't think we know about them,
That's a
or
good
they,
point.
even worse, a pharmacist may say, why are you taking that? A patient's going to take it anyway, but not tell us.
Yeah, that's a good point. They might not be able or willing to share that information. So that's something to consider too as a pharmacist, to be able to have empathy and make patients feel comfortable with telling that. So I'm sure that's a whole part of it as well.
It's a very important part, because without knowing anything about integrative strategies or products, dietary supplements, one might have misconceptions that could be conveyed verbally or non-verbally to a patient and make it so they don't want to talk to us.
Right, right. So let's transition over to hours and day-to-day activities. What is it like to work in your field? Is it 9 to 5? Is it nights? Do you work weekends?
Oh, that really depends. Swathi and I have very different hours sometimes and different tasks. So um, I don't think that there's any, if you're doing it in a retail setting, then you have the retail hours, but a consultation could be anything. Swathi, do you have an opinion on that?
Yeah, I think it really just depends on what's going on. If we have some projects coming up or some deadlines, or if we're preparing some slide decks, sometimes we do meetings on Sunday nights, sometimes we do meetings on Tuesday mornings. It really just depends. It's
Depends
very
on
variable.
yeah, that makes sense.
Yeah.
Yeah, and so it's fairly unlimited depending. And I think many pharmacists can start right where they are. And many pharmacy students that have jobs can just start opening up to what people are saying and what's on the OTC dietary supplement aisles of the places they work. Or if they're doing transitions of care, they can find out what the patients are going to go back to taking, doing medication reconciliation, find out what vitamins they're taking and who suggested it and whether their doctor knows. So really you can start anywhere, I think.
Okay, you can start anywhere, and it sounds like it's really it can it sounds like every day is so different, so it keeps it interesting. Would you say further training is necessary? I know the residency, I'm sure, helps open your eyes into the research and the everything involved with integrative medicine. But would you say that is it enough to get like a master's degree or on the job experience?
I think I'll have Swathi talk about that. I've learned this on my own, on the job, and because I had to, there really weren't programs. But Swathi, you've been exploring some programs, haven't you?
Yeah, definitely. And I also, to answer your question, I would say training, whether that's formalized training through taking a course or a residency, or if it's just informal and it's just informing yourself through other methods like podcasts and articles and things like that.
Okay.
Well, that's what we're doing
Hmm.
with Farm Supplement. We're trying to make
Yeah.
this a very concise, practical information and a platform, an educational platform, so that one would know what you need to discuss this with a physician or a patient, how to think about it, and then lots of resources for further in-depth study.
Okay, and then that's when you and that's when you guys started. Could you tell us a little bit more on the on Farm Supplement?
Well, it's pending. We're going to launch it in a few months. There's been a little interruption with current events going
Right.
on, which has
Yeah.
changed everything.
Understandable.
Yeah, so we can provide a link so that listeners can be notified when that does go live. But we're still working on it, refining it, trying to make it real applicable to contemporary pharmacy in lots of areas.
And one last question to wrap up here. In terms of the future of pharmacy, where do you see pharmacy going, especially with what you're doing and what you're learning?
I'll let the new graduate talk about where
Good
pharmacy is going,
insight. I
please,
know you're
because I'm so excited with pharmacists like her coming on board. It's
right.
looking real good.
I would say that the way that I see it is that a lot of it will start overlapping. A lot of different, when it comes to integrative health, for example, looking into a lot of different modalities that involves a lot of interprofessionalism. So I think there'll be a lot more team-based. They're more of that team-based approach to help a patient. I think like using a wide variety of resources and media will become very much like a mainstay of education. Yeah, I think that those are my initial thoughts. What would you
Yeah,
add, Dr. Tarlow?
yeah, I think so. I think that in my view, my worldview of pharmacy, integrative strategies, supporting immune systems, uh, helping the way that the body naturally responds to challenges, that's becoming more and more important. More and more important with the role of inflammatory diseases. So I believe that pharmacists are going to get more involved in how to support the body before it needs pharmaceuticals, and that patients want one place where they can go, where they can talk about a lot of things and find a knowledgeable, caring healthcare practitioner. The other area that I see pharmacy going into, because we're the ones that should, is having to do with cannabis based medicines, so that patients also can get the medicinal use of cannabinoids is about the most exciting thing that I've come across in the last 5 years.
Yeah, and
Mm-hmm.
that's
Yeah.
a whole section of pharmacy in itself, from my understanding. And I think I agree. I think that cannabis-based medicine is going to become huge in the next upcoming years of pharmacy. Up ahead.
Yeah,
So
that
Mm-hmm.
varies from state to state. So geography would have to do with that, but not just saying cannabis based medicine is the way to go versus not doing anything else. Diet, exercise, meditation, possible dietary supplements, medication when needed, to integrate all of that into a fairly cohesive, or at least a patient centered shared decision making plan. That's how I would like to see pharmacists and
absolutely, it's
pharmacy.
not just separate. It's you got to combine all the factors.
That's
Definitely.
the integrative part of it.
Yep, that's the integrative pharmacist speaking. I love it. Well, thank you guys both so much for sharing your experience. I know a lot of people listening to this will definitely benefit from your insight and can look to you guys as leaders and can hopefully connect with you on LinkedIn if they're interested. And I will
Please.
definitely be sure to add the links that you guys send underneath this post so you can get more information.
Thank you for what you do with all the
Oh,
non
thank you.
traditional things. I've really enjoyed your podcast. Thanks
Thanks
for
a lot.
inviting us.